Hi, good afternoon. My name is Eduardo Celis. I'll be talking today about the basics of oral health and also a little bit about what a dentist, what a dental hygienist, and what a dental assistant does in the field. So we're going to be talking about the importance of oral health, the prevalence of disease, dental terminology, and prevention as well. So why is oral health important? So oral health is connected to your general health, okay? It goes hand in hand. It impacts the ability to speak, smile, taste, and also to digest proper nutrition. It also affects one's everyday quality of life, from being able to smile, right, and to be able to talk, pronounce things properly. The prevalence of oral disease. Dental caries is the most common chronic disease of childhood, okay? 50,000 cases of oral cancers are also diagnosed annually in the US. Periodontitis disease or deep gum disease will affect 50% of the US population. And tooth decay can be prevented. That's one of the good news about this, okay? So let's talk a little bit about the tooth anatomy. So the tooth is going to consist of a crown, roots, okay? And in the crown portion, we have the outer layer, which is the enamel, which is the hardest tissue in the body, which is going to protect the dentin. Dentin is going to then also be providing sensation of pain if it's too hot, too cold, if there's a caries or anything that is a strong stimuli to it. And then that covers as well the root. The root is the pulp. The pulp is going to be basically what gives life to the tooth. Okay, and so the crown, as I said, will be composed of enamel, dentin, and the roof, or partially about a part of the root. I mean of the pulp. Excuse me. And the root portion will be then comprised of the bone, cementum, periodontal ligament, and then finally the gum tissue, which is going to surround it and maintain it in its place. Okay, so what are cavities? Let's talk a little bit about that. And also, we know them as tooth decay. So cavities occur when bacteria in plaque metabolize the dietary sugars to make acid. The acid will demineralize the tooth and it creates, as we know, a cavity, a hole, okay? You probably, if you've had one, you probably see that there's these little openings in the crevices of the teeth, right? And it looks dark, right? It might look anywhere from yellowish to brown or even black. So continuous acid attacks can cause the enamel, which is that layer that we discussed, of the tooth to break down. And so refined sugars found in candy, crackers, and soda make it easier for bacteria to break down into that acid. And cavities can happen on any surface of the tooth, okay? When we talk about teeth, we have a facial, a lingual, an occlusal area, right? An interproximal, which is in between the teeth. And in all of these areas of the teeth, we can get those cavities, okay? That's why we'll talk a little bit about preventative measures for that. And so saliva acts as a natural defense to help repair enamel. Our saliva is very important, okay, to help us remineralize the enamel. Okay, so people who are going to have certain under certain medical treatments or have certain medical conditions that inhibits the saliva production or the quality of the saliva, and people that are have this situations will have more are going to be more prone to cavities. Okay, so the stages of caries development. So it all starts with enamel caries, right? That and it doesn't necessarily have to be a dark brown color, as you probably all know. It sometimes even starts with a white lesion, right? And that means that it's the initial stage of caries. If that is not taken care of, then this will progress and advance through the tissue. And then finally, so when the enamel is going to be affected by caries, it really doesn't hurt, right? It just you can't feel it because the enamel is the majority of it is inorganic material. But once it passes the enamel and enters the dentin that carries, it travels all the way to the dentin, then that's when we are going to probably experience sensation or pain with anything that might be hot, sweet, cold, even with air. Okay. Once it passes the dentin and it goes into the pulp, we get a situation known as pulpitis, which is an inflammation of the pulp, and this is very painful, right? It'll be, if you've ever experienced a toothache, or if you've ever had a root canal, you know what I'm saying. It's a throbbing, intense pain that won't go away. And so once the caries reaches to the pulp, then the pulp, which gets inflamed, will basically die. Okay. There comes a point where, if not treated, that pain will subside. It will go away. But that does not mean that the infection process is gone. It just simply means that it's going to carry on to different parts of the mouth, may it be the adjacent tooth, or even worse, into the gum tissue, which will lead to a condition known as periodontitis, okay, inflammation of the gums. Fortunately, in dentistry, in the mouth, it is very noble. There is a lot of options to restore and get your mouth back to health. Okay, so whenever there's a situation where we have caries in the enamel, right, we can do, if it's in the initial stages, we can just do fluoride treatments, we can place sealants. If it gets to the dentin, then there's these different types of fillings that can be placed, such as composite fillings, amalgam fillings, incrustations, onlays, inlays, crowns. When it gets to the point of having to be to the pulp, root canals is an option. Place a post, a crown, right? And even when there's an option, even when the tooth is no longer savable, you cannot save it, then you can extract the tooth and place an implant. So right now, with technology, with all the advancements in modern dentistry, there should be no reason why a person cannot have a healthy and beautiful smile. All right, so let's break down dental decay. So we have dental infection, which is going to be serious and life-threatening if not treated. When the problem is small, seek treatment to prevent infection. As I was mentioning right now, everything, unfortunately, we are motivated by pain. If it doesn't hurt, we usually don't seek treatment, right? And one of the good things about our mouth is that a tooth will tell you, hey, it's bothering me. Hey, it's bleeding. Hey, it's inflamed. I have a weird taste, sensation, discoloration, etc. All of these are signs and symptoms that are going to help you to go ahead and take action. Risk factors, frequent snacking between meals, consuming high amounts of sugary foods and drinks, and also medication may cause the mouth to be dry. And symptoms for dental decay will be swelling of the face or in the mouth region, redness in or around the mouth, pain, of course, and a bad taste or change in the mouth. So to prevent tooth decay, ask your provider first and foremost, but fluoride has been a very effective tool that was established in the 70s and dumped into water, and this helped rural areas where there was no dentistry available to help reduce the caries in people. So fluoride is a naturally occurring mineral that helps protect against cavities by making the outer surface of the teeth more resistant to that acid attack. And there's different options. For example, fluoride varnishes, they're going to be a protective coating that is painted on the teeth to help prevent new cavities and also to stop cavities that have already started. So it arrests the lesion. We also have topical fluoride, which is found in toothpaste and mouthwash, and it helps to protect the teeth. You can find this in over-the-counter mouthwashes or toothpaste, and also systemic fluoride, which is found in tap water, okay, which helps strengthen your teeth and bones. There's another option as well known as dental sealants, and these are a protective plastic coating that can be applied to the chewing surfaces of the back of the teeth where decay it often occurs. Sealants protect the grooves within the teeth from that bacteria that may be that may cause those cavities. So now we talked a little bit about tooth decay. So how does it all start? It all starts with what we know as plaque. So what is plaque? Plaque is a sticky, colorless to tooth-colored film containing bacteria that forms daily around your teeth. So even if you brush your teeth really well, after a couple of minutes pass, that plaque will form, very thin pellicle will form and cover your teeth, okay? That is going to be containing bacteria. But remember, in our mouth we can have either good bacteria and bad bacteria. We want to make sure that the one that prevails is a good bacteria so that it won't allow the bad bacteria to create caries, to create periodontitis, etc. So plaque that is not removed with daily brushing and cleaning between teeth can eventually harden into calculus or tartar. This can result in cavities or irritation of the gums. And so this, if not removed, then it creates that hardened calculus around the teeth. And with time, if it's not removed, it goes underneath your gums and it starts to destroy the bone that will support the teeth. And that is when you see people that have really long teeth, right, or mobility in their teeth, or really foul odor in their mouth. And so let's talk about those types of oral diseases. So gingivitis, you probably heard this, almost everybody has had this at some point in their life. This is something that is normal, and it's a good thing. It's a sign that something is not right in your mouth, and it's indicative that you need to address it. So basically it is inflamed gums, red, swelling, and bleeding that is caused by plaque or hormonal changes. And so just to let you know, sometimes in my practice I see that they ask me, I ask patients, do you floss every day? Do you brush your teeth? Yes, and then I ask them, does your gums bleed? And patients will sometimes say, yeah, just a little bit, not too much. So just to make sure that it's clear, a healthy mouth does not bleed, okay? So if it bleeds, it's not right, and it should be addressed either by flossing more, proper brushing techniques, or having professional cleaning done. So periodontitis will be what follows of gingivitis if not taken care of. So periodontitis is a chronic gum disease that may lead to a permanent bone loss and also tooth mobility. Substance use and abuse will also affect, such as alcohol and drugs. They will increase the risk of tooth decay and also to certain oral cancers, okay? And also, of course, permanent loss of teeth. And oral cancer, okay, it's an early sign that may include a sore, color change of the oral tissue in the base of the mouth, on the mucosa, or on the tongue. It can be painful or also just a lump, and it can occur with no risk factor. However, it's often associated with tobacco use or smoking. And so finally, with this 5 steps of prevention. So to have a healthier to have a better oral health, so brush twice a day, morning and night. Preferably is after every meal, but I know everybody works. We have time. We have this. At least morning and at least night. Night is important. Floss at least one time a day, preferably at night, right? Because that's after when we go to bed, we have anywhere from 7 to 9 hours where we are with the bacteria in our mouth, right? And that's where they can cause the most damage. Also, choose fluoride toothpaste, mouthwash, and systemic fluoride in tap water to strengthen your teeth. Eat healthy meals, okay? Limit sugary foods, and choose water for drinking. And also try to maintain a regular checkup. Don't go to the doctor when it hurts. Try to be proactive and be what is known as preventative, right? Prevent it, okay? So don't delay necessary treatment. Okay, so we talked a little bit about the basics of oral health. Now I'm going to talk about a little bit about the description on what a dentist, a hygienist, and a dental assistant will do. So a dentist diagnoses and treats problems with teeth and tissues in the mouth, okay, along with giving advice and administering care to help prevent future problems. They provide instruction on diet, brushing, flossing, the use of fluorides, and other aspects of dental care. They remove tooth decay, fill cavities, examine x-rays, place protective plastic sealants on children's teeth. They straighten teeth and also repair fractured teeth. They also perform corrective surgery on gums and supporting bones to treat these gum diseases. They extract teeth and make models and measurements for dentures to replace those missing teeth. They also administer anesthetics and write prescriptions for antibiotics and other medications. For the most part, dentists are solo practitioners. They have their own business, they work alone, they have their own staff. They work 4 to 5 days a week, anywhere from 35 to 40 hours a week. Dentists usually work in a safety of an office environment. And a little bit about the employment opportunities for dentists. The dentists held about 141,900 jobs in the U.S. They are primarily general dentists, okay? And only about 15% of dentists will specialize in either surgery, prosthodontist, endodontist, etc. And so for the most part, all dentists work in private offices. There must be, to qualify for a license in most states, candidates for this must graduate from an accredited dental school and pass a written and practical examination. So it's a full 4 years post-bachelor degree, okay? Most dental students have at least a bachelor degrees before they enter into the dental school. And so licensing is required to practice as a dentist in the United States. And so for these requirements, they must have a passing written and practical examination in addition to having a degree from an accredited dental school. Some of the other qualifications that dentists must have is they should have good visual memory, excellent judgment regarding space, shape, and color, a high degree of manual dexterity, scientific ability, good business sense, self-discipline, and also good communication. Many practitioners teach part-time. Some dental school graduates work for established dentists or associates for 1 to 2 years to gain experience and money to open up their own practice. The employment of dentists is projected to grow by 60% through 2022, which is faster than the average of any other occupation, okay? And so the median wage of salaries for general dentists is anywhere from $142,000 to $150,000 a year, okay? So let's talk a little bit about dental hygienists. The dental hygienist will clean teeth and provide other preventative dental care. They also teach patients how to practice good oral hygiene. They examine patients, their teeth, their gums. They record the presence of a disease or any abnormality. They also remove calculus, stains, and plaque from teeth. They also help with developing x-rays. They apply cavity preventative agents such as fluorides and pit and fissure sealants. And in some states, hygienists can administer local anesthetic gas. They can place and carve filling materials, place temporary fillings, also periodontal dressings, remove sutures, and also smooth and polish metal restorations. For the dental hygienist opportunities, again, 174,000 employees, jobs, excuse me. About 51% of dental hygienists work part-time, and almost all jobs for dental hygienists, about 96%, were in office for dentists, okay? They also, prospective dental hygienists must become licensed in the state in which they wish to practice, and so they have to have a degree from an accredited dental hygiene school. For education and training, so a high school diploma and college entrance test scores are usually required for the admission to these hygiene programs. High school students interested in becoming a dental hygienist should take courses on biology, chemistry, and mathematics. And also some dental hygiene programs, require applicants to have completed at least 1 year of college. The dental hygienist should work well with others because they work closely with dentists, dental assistants, as well as directly with the patients. They also need good manual dexterity for all the procedures that we mentioned before. And the advancement opportunities, working outside the typical dentist office, it usually requires a bachelor or master's degree in dental hygiene. Okay, some dental hygienists may pursue a career teaching in dental hygiene programs, working in public health, or in corporate setting. It is among the fastest growing occupations in the U.S. and employment of dental hygienists is expected to grow 36% 2020. Okay, this projected growth ranks dental hygienists among the fastest growing occupations and respond to increasing demand for dental career. Okay, so the median wage for dental hygienists is $66,000 a year. The middle 50% earn between $55,000 to $80,000 a year. And now let's go over dental assistants. The dental assistant will perform a variety of patient care, office, and laboratory duties. They work chairside as dentists and hygienists examine treat patients. They make patients comfortable, they prepare them for treatment and obtain dental records. The assistant will hand the instruments and material to the dentist and keep the patient's mouth dry and clear by suctioning or other devices. They also sterilize and disinfect instruments and equipment. They prepare the tray setups for dental procedures and instruct patients on postoperative and general oral health care. Dental assistants' work environment is basically in a well-lit or lighted, clean environment. Their work area is usually near the dental chair. They wear gloves and masks to protect themselves from infectious diseases, same as dentists and dental hygienists. And following safety procedures minimizes the risk of handling radiographic equipment. About 93% of all jobs for dental assistants were in office of dentists. A small number of jobs were in federal, state, and local governments or in offices of physicians. And some dental assistants worked part-time, sometimes more than one dental office, so they can work in several places. So many assistants learn their skills on the job, although there's an increasing number that are trained in dental assistant programs. Many states require assistants to obtain a license or certification, especially if working with radiation procedures, which is basically going to be, for the most part, every dental office. In most states, there are no formal education or training requirement to become an entry-level dental assistant. So high school students interested in a career such as this should take biology, chemistry, health, and office practices. Most states regulate the duty that dental assistants are allowed to perform, and so licensure may include attending an accredited dental assistant program and passing a written or practical examination, which is going to be available through the DAMB. Some dental assistants become office managers. They go on to do dental assisting instructors, dental product sales representatives, or insurance claim processors for insurance companies. Also, employment for this field is to grow 36%. Dental assistance is expected to become the fastest growing occupation since 2008. And job prospects for dental assistants should be excellent, as dentists have a continuing need for qualified dental assistants. The median annual wage for these dental assistants will be $32,000 a year. And so that will be it for my presentation today. So we talked about oral health and a little bit about what dentists, hygienists, and dental assistants perform. Thank you so much.